Welcome back. ESPN's Jay Harris recently announced he is undergoing treatment for prostate cancer after being diagnosed this summer. Now the longtime sports anchor is on a mission to educate others and normalize the conversation around men's health. He joins us now to talk more about how he's raising awareness right here in the city of Memphis. And we welcome Jay Harris along with State Representative G.A. Hardaway and Ken Carpenter, President of the Prostate Education Awareness Council. Gentlemen, glad to have all three of you here today.
Good to be here.
Jay, good to see you.
You too, brother.
We know you have told and have reported on some of the biggest sports stories, especially in your illustrious career, but you wanted to share a personal story with others that could perhaps save lives. Why?
That was the goal, because I have a voice. And, you know, some things are given to you for a reason, and that's kind of how I felt this situation was going. And since the summer, since my surgery to remove my prostate, and my doctor telling me that he got everything and I'm cancer-free, my job is to go out and tell folks, men, to get tested, get checked, monitor your health situation, take care of your family, so we can all be healthy.
Yeah, I was reading a quote of yours. You said, we all need to talk about these things, and I hate to be morbid, but we sentence ourselves to death by not talking. That's very powerful there.
Yeah, I mean, I didn't want to be morbid, but that's the bottom line. If we don't do this, I mean, prostate cancer, I was talking to Ken earlier, I mean, no one wants to get cancer, but if you're a man and you get a cancer, that's one you want to get. It's treatable, you can live, but if you don't do the things that you need to do to your blood test, your PSA, to check everything, you won't live. You're sentencing yourself to death, and you don't have to. You don't have to work. You don't have to leave people behind. You don't have to do any of that. You can live easily, and you can help other people do the same thing.
Yeah, Jay, how are you feeling today?
I feel pretty good. You want to go out and play some basketball?
Let's do it.
Play some golf?
Well, but we can still do it. Ken, this is a conversation many of us, especially men who look like us, black men, we don't always have this conversation. How do we change that?
We don't. And I run into that in our office, which actually caused me to get on my journey. Pretty much the same, going out. I have a voice. I felt I could not be silent. Listening to some of the denial stories, men in disbelief.
Why denial
those
stories?
Who decide.
What do you think that is?
Well, a lot of them actually are scared. And there's a stigma that goes along with having prostate cancer. Okay, so they didn't want to be brave like Jay and I are. You have to be first brave to go out and tell your story, but also recognize many don't realize that their families will not leave them. Their families are with them. So my mission was similar to his. I had a voice. We went out and opened up a 501c3 nonprofit.
Okay.
And we've got some sponsors behind us. And I will say that I always like to tout our big horn. We screened last year 93 men all in one day, in a one-day event.
That is incredible.
And that's the most, I was told, that has ever been done in a one-day event. So we needed to keep the journey going. Why stop?
Why stop?
We had a mission.
Sure, that we are.
We had a mission.
G.A., when you and I were talking about Jay being in town, especially this week, and you talked about the possibility of coming on today at 3, you said, Alex, we need to save lives.
Oh, absolutely, and that's what I appreciate about Jay, and certainly about the work that Ken and the Carpenter family. I often say that that family saves lives, because he's got everyone involved, from his lovely wife, Dr. Carpenter, to the rest of the family. And there's something symbolic about that, because it's a family that's going to help to save the lives of these men. The support itself, the urging, we know that more men live longer if they're married or have a significant other. And it's simple. It's because that wife or the girlfriend or fiance is going to bug you to stay healthy, whether they have a selfish motive or not. They want you to be healthy. So that within itself means that you need to have a support system. But it's not going to matter if you don't get educated, if you don't get treatment, if necessary. Those are the two things most important.
Jay, we heard G.A. just say and mention about family. I know my brother is a prostate cancer survivor as
Okay.
well.
How's he doing?
He's doing great.
Good.
He is doing very nice. Thank you for asking. When it comes to this, though, when it comes to our families and this being something maybe even hereditary, is that another reason we need to really take this as serious as possible?
It's the reason my doctor and I have been looking at my PSA all these years, because my dad had it. I mean, he did radiation, and he came through it fine.
Okay.
But it does tend to run in your family. And I probably overshared with my son, who's 26, but he needs to know, granddad, dad, chances are. So take precautions now. Diet, exercise, all the things you need to do. Make sure you go to the doctor and get checked every year. And yeah, take control.
You have a big event coming up, I think in about an hour or so from now at Lemoyne Owen. Is that Ken?
Yes, it is. We decided to try to, and luckily got Jay Harris to come to Memphis to tell his story. We brought him in, ESPN. We felt that that would definitely draw people out, because as he mentioned, he's a person that people, they will look up to. And men would probably listen to him.
Yeah.
So we decided to go after Jay, bring him here, let him tell his story, and we'll be at Lemoyne this evening, and it is from 5 to 7 p.m.
All right. Ken, we got to talk sports just for a second here. What are you seeing NFL-wise? What are you seeing college football? What's exciting you these days?
The games. The games. No, really.
Okay.
Because I get that question all the time, and I kind of steer away from the prognostication because
Sure.
I just want to enjoy every game because it's so early in college and the NFL. So I'm going to enjoy it until it gets to the time where I need to be, talk about either championships or divisions or conferences.
And what about the Memphis, Tennessee image? I know we've taken our knocks from a colleague of yours, Stephen A. Smith, when it comes to the Grizzlies and whether or not players are reluctant to come here. What are you hearing about this city? What are you feeling now that you've been here to visit?
I haven't. I don't know if that's fair because I haven't heard anything.
Okay.
We went to the museum earlier today, and I don't know. That I cannot answer that question. Give me like another couple of days.
Okay.
And I'll bring something back for you.
We'll talk about it again.
All right.
Jay Harris.
If
Go ahead,
I
Jay,
may,
very quickly.
Let me extend my condolences to Kanji, but also to make for the loss of her mom, but also to make note that Kanji helped to give us a platform to make the inroads we did with HIV, AIDS, education, awareness, and treatment, and it's that same way that we plan to approach this.
All right. It's a winning approach for sure. Gentlemen, thank you very much. Unfortunately, out of time here. We've got to go to weather. We do appreciate it.